Thank you very much for inviting myself and Marie-Claire. I will speak briefly on behalf of you, Marie-Claire.
Thank you.
So what's going to happen is I'm just going to present a little bit about what we know about personality change after brain injury, and then I'm going to hand over to Marie-Claire, who's going to talk about her own experiences. So if you give me a second, I'm just going to share some slides, and we can make a start. So, just a little bit of background on how we became interested in this topic. So there's a group of us based at UCL, Exeter University, Addenbrooke's Hospital, kind of researchers and clinicians who've been working with Headway East London for several years on a number of projects, really. And we became really interested that during our discussions with members, personality change after brain injury, there was something that came up in a lot of conversations with members and their families. And they frequently shared their experiences and asked us as researchers, what do we know about personality change after brain injury? But actually, that was quite a hard problem to question to answer. A lot of the information is kind of scattered all over the place. And so what we did is something called a systematic review. Now, in science, when you want to get lots of medical research and try and get the best answer, synthesize all of that information, you do something called a systematic review. This is a formal process where we search all of the databases of medical research and then synthesize everything to come up with some of these answers to some of these really important questions that the members had raised. So this is exactly what we did. We got together as researchers and we did a systematic review prompted by these questions from the members of Headway East London. And really, this is what this presentation is based on. So the first question that came up is the question of how is personality change defined, which really kind of leans on this question of how is personality defined. And this can be quite hard. It's one of those things that, we talk about all the time, but actually when you ask people, what are you talking about when you're talking about someone's personality? Sometimes we struggle a little bit. Psychologists tend to use this definition: a set of enduring traits, behaviors, thoughts, and emotional patterns that consistently influence how an individual interacts with the world, others, and themselves. But there's still quite a lot of uncertainty. So this was a bit of a challenge. And then we decided to take a different tack. And instead of trying to define personality and personality change, we decided just to see how it was defined in the medical studies that were researching personality change. So every time one of these studies mentioned a symptom of personality change, we wrote it down. And this is the list we got. It's absolutely massive. So you can see that probably any aspect of human behavior has been defined as personality change at some stage. I mean, there's kind of like mental health problems, changes in mood and your emotions, changes to your behavior, being a bit impulsive, thinking skills, social aspects, our interpersonal lives, motivation and activity, and identity and self-esteem. That covers a kind of quite a broad area of who we are as people. So we took this list and we looked at which were the things that were the most commonly identified as personality change in these medical studies. And this was the list that came up. So when medical studies were talking about personality change, they were usually talking about irritability and frustration, depression, changes and unpredictable changes in emotions, anger, withdrawing from social situations, anxiety, being impulsive or impatient, being restless, sleep disturbed, or on the other hand, really fatigued, and being aggressive. Now, this is what medical research focuses on. This is the kind of second time I've done this presentation, and we went to Headway in Romford and we presented these results to the members there, and they had some really interesting kind of thoughts on this that also came up in some of the work we did with Headway East London, which is that, well, actually, it's interesting to hear how you lot, researchers and doctors and clinicians, define personality change. But actually, this misses out some really important stuff that affects either me as a survivor of brain injury or me as a carer of someone with brain injury. Frequently, people said, do you know what? Sometimes things change which aren't on your list, which may seem quite subtle, but have been really important for us as a family. And sometimes people said some really interesting things. They said, do you know what? Something's changed. We can't quite put our finger on it, but actually it's had a really big effect on us as a family. It's kind of changed us as a family, and it's made things really difficult sometimes. So sometimes some of these kind of changes in terms of being less enthusiastic, being less affectionate, being a little less interested or motivated, or sometimes a little bit kind of obsessive and things like this. These were the things that people mentioned, which aren't really in the list that comes up from medical studies, but were really key for lots of the people we talk to. So it's worth noting that, actually, it'll be interesting to hear from all of you as well, and fascinating to hear from Marie Claire how complete this list seems, because it will tell us about where medical research is lacking in understanding this problem. There was one study which I found really fascinating. It was quite small. It was only on about 60 or 70 survivors of brain injury, but I thought it was really interesting. So they asked survivors of brain injury and their families, um, which of these people have had a personality change out of all of the people with who survived brain injury. And actually, survivors of brain injury and their carers tended to agree, right? So when a survivor of brain injury said they had a personality change, their carers also tended to say their personality change. Carers tended to be a little bit more commonly say that, but actually 70, 80% is a pretty good level of agreement. But in this study, there was almost no agreement on which personality change has happened, which traits had changed. And I find this really, really kind of interesting and really telling study. There may be lots of reasons why someone who survived brain injury may have identified different changes in personality in themselves when in comparison to their family, who may have identified different things. Some of these can be just down to typical disagreement, let's call it. So, for example, if I describe my personality, probably my family would disagree in some aspects, and that probably applies to you and everybody here. It may be that, as we know, brain injury can affect your ability to judge yourself. And for some of the cases, this may have been the case. It may have been the case that, in any sort of disagreement or difficulty or tension, people come up with different explanations for what's happening there. And we know from talking to lots of people with brain injury that this dilemma about, is this them or is this the brain injury, can become quite important in some of these kind of discussions and disagreements sometimes. But it is just worth noting that, while there was agreement in terms of there being personality change, exactly what had changed was not always something that families and people with brain injury could agree on. So we also tried to answer the question, how common is personality change? And we looked at two definitions. One is called personality disorder, which is a very severe form of personality change, which could get medically diagnosed as a personality disorder. And that means your personality has changed so much that it's causing you a level of disability or a level of distress that can be quite difficult to deal with for both the people and other people around them. And we also looked at any personality change as detected by rating scales that are sometimes used. These tend to have a much broader definition of personality change that aren't just about people being really disabled by it. And so we did something called a meta-analysis. This is a way of taking all of these kind of numeric results and doing a statistical analysis to pick out how common is these sort of things overall. And we found that after traumatic brain injury, and this is what the studies were on. So we would assume this might broadly apply to other sorts of brain injury like stroke and lack of oxygen and anoxic brain injury. So after brain injury, 28% of people had a personality change that was so severe it might get diagnosed as personality disorder, and at least 50% of people after brain injury would have had personality change recorded. Now, these are quite high levels, actually, right? Probably more common than depression or anxiety after brain injury. So, it's worth keeping that in mind, just in terms of, how common the problem is compared to how well we're dealing with it, actually. It'd be interesting to hear your take on those things. We also tried to understand how long does personality change last by looking at some of these studies. And it's worth saying the studies on this aren't great. They often had less than 50 people in them, although there were a few. So there was about 6 or 7. They did follow up people over several years, up to 5 years in the case of one study. And these studies tended to show that personality change remained stable. In other words, it was quite constant over the subsequent years. It's worth noting here again that these are on the definitions of personality change used by these medical studies. And what members at Headway have told us is, do you know what? Actually, they feel they have changed as a person. They have grown as a person. Some of these things don't apply, but maybe these are the sort of things that are not being picked up by some of these medical studies because they tend to focus on quite a specific definition. Okay, this was not such good news. We looked at what treatment and support has been researched for people who've experienced personality change after brain injury, and virtually no studies have tested treatment for personality change. There are some studies that have looked at medication for aggression. That's a very specific aspect of personality change. The majority of people who experience brain injury and personality change won't be aggressive at all. You know, you can see why this might be something that people be interested in looking at, because of course that can be really difficult and risky for people, but it's still a very tiny aspect of what we're talking about. So really, there are no kind of medical studies, medication studies looking at this. We found no studies, literally 0 studies that had researched psychological support for survivors or their families. We might want to discuss in the Q&A what sort of support is available, because just because it hasn't been researched doesn't mean to say it isn't going on. For example, I know Headway East London have a family therapy service. In our clinic, in the hospital, we have psychologists that support people, but it's just worth saying that this support is kind of done, how can we help people based on what's going on for them, rather than any studies particularly looking at that. So this is our kind of overall take of what we understand about personality change after brain injury based on the medical research. And I'm now going to hand over to Mary Claire, who's going to give you a much more vivid and personal account.
Hello. My name is Mary Claire. I had a brain aneurysm 10 years ago in November it will be. And my immediate change in my personality was when I woke up, I had no feelings for my children at all. Before I had the aneurysm, I used to basically take in teenagers and also babies, the people that don't want, don't want to be fostered because they're too difficult. So I would take those people. So I had so much love to give. And then after I woke up, I had no love to give. I recognized my children, but there was no feelings there at all for them. And that amazed me, even in that state that I was in, that I didn't love them. And I had to take time to love them again. I had to learn to do it again. And it wasn't something that I learned in the first place. It was innate in me. So that was a massive personality change. And my aggression was off the scale. In hospital, I would stand on my bed. It was in Royal London, so there's a lot of Asian people that come through. Anybody with a scarf on their head, I would stand on my bed and shout Taliban at them. Considering I'm brown myself, and it wasn't something that I would dreamt of doing before I had a brain injury. Wouldn't have entered my mind at all. And yeah, my aggression, I almost killed my partner when I came home. He had said something to me, and I was ironing in the dining room, and it's linked to the front room where he was. And I actually ripped the iron out of the wall and threw it right across the 2 rooms. And if he hadn't have ducked, I'd be in prison right now. But I didn't care. I really didn't care that I was hurting them. And I knew what I was doing. And that's the weird thing. I enjoyed being bad. And it was like an alter ego of mine had come out that was in there, but I was such a good person before. I really strived to be a good person. And now I actually strive to be not a great person. And it kind of gives me a little bit of pleasure. And I've never admitted that to anybody. But yeah, I am so different to who I was before. I'm actually the complete 180 of who I used to be. I couldn't hold down a job now for nothing. But yet I looked after 15 men. I had a property maintenance company. And I even learned how to sue somebody because a company owed my company £90,000. And I learned to do that myself. I was such a driven person. But now I have a pile of clothes in my bedroom that has been on my floor for 2 weeks now. And I keep passing my bedroom and looking at it and thinking, yeah, tomorrow. And I'll probably do that for another month. So the alpha in me is gone completely. Yeah, I'm more of a beta now. So yeah, my personality did a complete 180. And here I am today.
Do you mind if I ask a quick question, Marie Claire?
No, not at all.
Just how have things changed over time from when you described being in hospital and being quite intense? I've met you a few times, and you've never thrown anything at me, I have to say. But you know,
Talk about my
things.
children.
How have things changed over that time?
I've become less aggressive physically, but the verbal aggression is still there. I use that quite a lot. And there's other things that have changed in my personality. I have a first class degree in maths, but I can no longer count even money. That's completely gone. And that was a massive part of my personality. It was like my superpower. But yeah, that's all gone. And that for me, I mourned that a lot when I first became as I am, because I really lent on that. That was such a big ability of mine that not many people had. And it was gone. And so I had nothing to hang my hat on anymore. About I wasn't even a mother anymore. I had a 10-year-old I wasn't allowed to speak to because I spoke about sex constantly, all the time, 24/7. That's all that came out of my mouth. So I got to a place where I wasn't even allowed to speak to her. She's now 20, with all the hang-ups she could get with having a mum like me. And we lived alone, me and her. I split up with my partner of 25 years, 6 months after I came back out of hospital for no good reason. I just felt like it. But he hung around and he still has helped me over the years. But I don't feel even that is not the same anymore. I feel very my emotions are blunted, if that makes any sense. I don't feel any of the highs that I used to feel, especially with loving somebody. Like I've got a granddaughter now, and it's not how I envisioned it was going to be. I can take her or leave her, which is a really weird thing to say about your only grandchild, but that's actually how I feel. But I don't let anybody know that because it's not normal. And I know it's not normal not to have really deep feelings for your children or your grandchild. And I still don't, but I fake it a lot to appear like a family woman, how I used to be.